This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. Did you know that the brain controls and regulates the health of your entire body? This is Dr. Tom Roselle. Think about this. When the brain-body's life force is blocked, physical symptoms begin. What if you knew how to prevent the deterioration of your brain-body system, avoiding chronic pain, dementia, Parkinson's, MS, and immune dysfunction? Join me on Saturday, October 17th, and I will teach you how to restore normal brain-body function. So what are you waiting for? Go to AgelessHealth2015.com or call 703-698-7117.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Good afternoon. This is Dr. Tom Roselle live. And yes, you do have the right station, but Dr. Tom's not here today. This is Sue Roselle sitting in for him because he's off running a board meeting out in Chicago for the International College of Applied Kinesiology. So we're going to be handling the program this afternoon. My guest in studio today is Dr. Scott Lamp. He's one of our fine associates at the office, and we're going to cover a very important, devastating and frustrating situation known as ADD, ADHD, attention deficit disorders, or attention deficit hyperactive disorders. This goes along with, and I'll just give a little information about Ageless Health that's coming up on October the 17th, which is going to deal with mind and body health. ADD and ADHD is a big part of this, and unfortunately it's a very frustrating situation that affects many, many people. We think of it as basically a child-type situation, but sadly, there's a lot of grown-ups that are now experiencing the same problems as far as being able to function well in their job, learning new skills, and so forth. So this afternoon, we're going to talk about a lot of the details on how this happens and what's going on. I have some older statistics, but Dr. Lamp will bring us up to date here that approximately 11% of our kids, ages 4 to 17, have been diagnosed with ADD, ADHD. And it seems to be increasing. It went up from 7.8% in 2003 to 9.5% in 2007, all the way up to 11% in 2011. And my assumption is that it's continuing to increase in 2015. There seems to be an increase in the diagnosis of this at about 3% per year. Boys tend to be more likely to have a problem with it than girls. And the average diagnosis occurs somewhere around the time a child is around 7. Although there are a lot of parents that will notice that their children are exhibiting some of these symptoms much earlier than that. Where the person is located as far as his home makes a difference. In other words, Nevada and Kentucky might have different ranges than North and South states in the Union. So I'm going to let Dr. Scott give you a little bit of more accurate, up-to-date statistics at this point. Good afternoon.
You're reading off my same sheet, Sue.
No, I'm not.
So I'm still trying to get some more information. That's exactly the same type of thing. I got about 11% roughly of the children 4 to 17 years of age. I want to say thank you for being here this morning. This is I'm working with the better half this morning.
Thanks.
So we'll see how things go with that. Yeah, I think it's we have an increase on it. And I think one of the things and one of the models we always talk about in our clinic, we're always looking at things on a structural basis and a chemical basis and an emotional basis. This is one that kind of fits all three of those. Even though everybody thinks it's chemical-based, there's a lot more things to that. And I think there's also different criterias for this. They're starting to break it down a little bit more. There's something called, which identifies 3 subtypes of it. There's ADHD, predominantly inattentive type. There's hyperactive impulsive type, and now there's a combined type. And it seems like when we go to the Diagnostic and Statistical Manual of the Mental Disorders, the DSM as they call it, we now have up to about 400 different type of diagnoses, and it seems like we're always trying to find something to fit in a hole. And what I don't like about this is each individual is an individual.
That's
and
right.
You got to make sure that you have something that you can customize to that person, and we start to pigeonhole these people into certain points. I mean, there's even...
Well, that may be why there's 400 different diagnoses.
Exactly.
Trying to do that.
And climbing... And I think there's a term for dyscalculia, which is actually doesn't get along or doesn't do math well, doesn't get along with your sibling disorder, doesn't take medication from the doctor disorder. I mean, they're disorders listed this way. And I think the thing is we're also human beings, and I think we're forgetting about some of that part.
That's right. There's a lot of individual differences, and this is where we want to get in a little bit to some of your information about is this a pathological condition? Is this a behavioral thing? Is it just typically active kids that don't want to sit still and they're bored to death in school because they're so used to video games and fast flashes on the TV and fast learning? Where do you see this?
I think it's a combination of all three. I think if you just do one part of it, I think you're missing it. I think it's multiple parts, because it makes multiple parts for the individual. Like I said before, I think if there's a structural component, there's an emotional component, there's a chemical component. I think you also say, where is the money coming from for pushing some of these? I mean, we've got some drugs out there like Ritalin, for example, and there's a huge amount of money that goes into those companies, but there's not a huge lot of money to look at. What about the nutrition side of that?
That's right.
There's not a lot of grants and things and money going started because there's no profit margin in those, so you don't see those. They're kind of pushed aside. You don't see the reports. The reports are there. You just have to look for them and find out what's going on with some of these things. And I think I think a lot of the doctors are not being educated enough to look at certain things. You have to really go in depth on the social aspect, I think, on quite a few of these things.
And what about that idea that the psychiatrists were trying to get across, that all incoming kindergartners were going to be screened for ADD, ADHD?
That's scary, because what are they doing? And if you're doing all of that, if you're doing mass, you're going to lose a lot of things through the cracks.
Sure.
So you're not. Is it just basically a sign-up form that you have like a survey that maybe 6 out of 9 of the possibilities are there that you sign the kid up to do that? I think you really got to look at a lot of different elements.
And again, you have to look at the maturity of a kid.
Right.
We know that little boys are less likely to want to sit quietly and read a book or listen to someone talk to them than little girls are. Not that little girls are exempt from that.
Yeah, well,
they want to get up and move around.
Yeah, like I referred to my son. You know, it's like I had it was a couple of years back when she had some friends over, and there were 3 or 4 friends, and they were sitting in their bedroom, very quiet as can be, and my son comes over with just another kid, and everything's like monkey bars. Mm-hmm. So they're just bouncing all over the place. Doesn't mean, but sometimes the boys are kind of like hunter and gatherers. They need to get some of that energy out, and exercise plays a lot part with that, and how much exercise is being done. Now, one of the things too is also what's going on in regards to the school age when somebody goes into kindergarten. We might have a old first grader and a younger first grader, and sometimes that younger first grader might be more of a kindergarten person. Mm-hmm. But when you look at the peers amongst the group, you might say, hey, this kid's not acting right. But he might be put up a grade that he's maybe not supposed to.
Not ready for yet.
So now you've got that kind of situation going, and you're judging him against the peers. That's what might be the teacher might do, because that's the only thing she's got to measure by.
That's right.
Is that a really true measurement? So you've got some of those kind of things going on.
What are some of the what they call soft criteria for diagnoses? What kinds of things do they use when they're trying to assess whether a child is just immature and active, or they actually do have a true problem with attention? Okay,
well, first off, you look at the inability to perform everyday tasks or distractibility, and this is for at least 6 months. Impairment to control impulses, impulsivity, and again, the timing aspects is a 6-month basis. Problems in the social environment, school at home, acting out, restlessness, hyperactive, general coordination deficits. I'll take that back. That would be something that probably I would look at a little bit more. Mm-hmm. But disorders of memory, maybe some thinking and stuff of that nature. But just saying impulsiveness, can't control, can't pay attention. And the thing is like sometimes if you're a parent, take a look if your kid sits down and watches something for 2 hours.
Yeah.
Then you start thinking, well, is this really a attention deficit type problem? Because they can stay 2 hours watching something. Then is there something else that might be going on?
Exactly.
Now,
exactly.
The other aspect you got to also consider here too is there's also the aspect of if this kid's been constantly being put down, how do you feel when you're constantly put down and all of a sudden you don't feel good about yourself?
That's
how
right.
would your body react in that kind of instance?
And oftentimes they'll overreact in any situation that's a negative thing. So, again, it's very difficult to put everybody into a nice, neat category that fits according to their criteria. I know they do have questionnaires that they use. I do know that they interview the teachers and the parents when they are assessing this, as well as observing a child. But, again, when people are observing children, having worked with children in another capacity years ago, when they're in an unusual situation with a stranger, they are not working the way they normally would. It's an unusual situation. It's strange. They're uncomfortable. They don't know the person. They're not relating to the stranger. Stranger danger kind of thing. They're in an unusual environment. They do feel like they're under a microscope because they are. And so their behaviors may not be representative of what's actually going on. So very often parents and teachers are probably the best people to assess that sort of thing than 1 or 2 time assessment by a professional. Not that professionals can't pick things up, but I think that sometimes children are given the bum rap on this because they're being assessed in an uncomfortable situation.
Well, let me interject on that too, because a lot of the recommendations are coming from teachers. Parents about 16%, about 30% from the teachers. But again, we got to look at our teaching style. Mm-hmm. And I think one of the things is that are we a kinesthetic type person? Are we a visual learner? Are we an audio learner?
That's right.
I know for myself, I do very visual. I like to put things together and look at things. When I always have a hard time remembering people's names, I'm great at people's faces. Mm-hmm. Unfortunately, I'm like, I know you. And so and everybody knows that because a lot of times, and unfortunately, my apologies out there, I butchered people's names, is that I like to visually see some things, and that's the kind of thing I like to do. Mm-hmm. My son ran into a situation with math class this last fall, and he's a good student. One of the problems is that they were having him go home and look at videos for the lesson plan. And he wasn't catching the idea. Not until he was working with my daughter, myself, and some assistant help, he did really well on his SOLs and stuff of that nature. But the problem was he didn't really learn well of that. When you have a misunderstanding, you start to squirm. You're not going to have this kind of like, oh, I'm going to relax and sit there. You feel like an idiot. You're not going to feel like you're going to be comfortable.
That's right.
And that'll cause problems and outbursts.
And they get frustrated. And
right, exactly.
When a child is frustrated, they usually don't sit there and quietly suck it up. They usually sit there and start throwing things or acting out.
Right.
I wanted to remind everybody that Dr. Scott will be presenting a full lecture on ADD, ADHD coming up this Wednesday evening, September 16th, in our office at Roselle Center for Healing in Fairfax at 7:30. And this is a free presentation. It's a continuing education program series that we have every other week in our offices. There is no charge to you, but we do ask that you give us a call so we can reserve a space for you because we do have a somewhat limited seating capacity. And that phone number is 703-698-7117. So that's this Wednesday evening at 7:30. Dr. Lamp will be talking more about ADHD.
Yeah, and I think this is we're going to have some handout sheets that you can actually work on different things. We'll talk a little bit about yeast and maybe some sugar aspects. Mm-hmm. We actually have some forms out there to kind of fill out, give an idea about it. We have information sheets on like neurotransmitters, how the chemicals in the brain, certain questions to ask your child to see if some things are off and something nutritionally might be able to help.
Right. We're coming up to a break right now, but we'll be right back after some very important messages. Stay tuned.
Did you know that the brain controls and regulates the health of your entire body? This is Dr. Tom Roselle. Think about this. When the brain-body's life force is blocked, physical symptoms begin. What if you knew how to prevent the deterioration of your brain-body system, avoiding chronic pain, dementia, Parkinson's, MS, and immune dysfunction? Join me on Saturday, October 17th, and I will teach you how to restore normal brain-body function. So what are you waiting for? Go to agelesshealth2015.com or call 703-698-7117. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Sue Roselle standing in today for Dr. Tom Roselle on Dr. Tom Roselle's Live. And if anybody has questions today relative to the topic we're speaking about, ADD, ADHD, you're welcome to give us a call at 888-630-9625. That's 888-630-WMAL. Dr. Scott.
Yep.
We left off just about ready to talk about some of the causative factors that you see happening with children and adults who have a problem with learning and attention and behaviors. What would some of those causes be?
Okay, well, I always like to look at the triad that we have. So there's the social economic, the emotional side, the structural side, and the chemical side. Social aspects, social dynamics right now, currently, we also have some things that now we have two people working instead of one. Sometimes that social dynamic can play a part. Also, we just talked about the aspects of certain things like how does a person learn? Are we really working towards that side or not? I want to touch on some of the other things that might be neurological involved. And usually what happens if we get a little bit of a hurt that happens along the way. Let's say the person has a problem, let's say in like a C-section baby, has a thing that basically the way the body is supposed to go through the vaginal canal and the vaginal birth, does some changes, pushes fluids out of the lungs, does some things to the cranial parts of the body to get the body going, and you don't get that with a C-section.
Kind of stimulating the child.
It doesn't stimulate the child the right way. Are we lacking oxygen somewhere along the line? We have a blue baby that comes out, maybe a cord around the neck of some sort. And also remember C-section, they got to get the baby breathing.
Right.
So there's some things that are there. Is there some hypoxia? And a lot of times there seems to be associated with some type of neurological hurt that goes along, which also means that you got to kind of take a look for those things.
Right.
Is there a balance problem? Is there some of those things? Did the child strike their head? We got kids that between 2 to 3 years old have fallen 1,500 times.
Oh yeah.
How many times have they struck their head, done certain things, and something seems to be off? So there's those things structurally. So we got to look for motion instability, general coordination things. There's things, interpretation in regards to sounds and smells and sight, which you can work on stimulating, but you need also don't know if those are a problem and it's not reproducing the information there. Also neurologically, as the neurotransmitters working, Ritalin is a stimulant. Right. And for some reason, the brain is not getting the information. The body's not clear and filtering. So we need a stimulant on somebody who already seems stimulated to get these things growing, go through. So,
stimulants actually do a paradoxical effect on children. They act to calm down a child rather than stimulate them.
And then also looking at our cultural connections, too. What's happening with our food supplies? There's a lot of things that are very, very important. There's things like magnesium, zinc that's not being put in our soils anymore. It's not put in our fertilizer.
No.
And so there's the topsoils are being taken away. And I think back to the Dust Bowl, back into the times of the Depression and things of that nature, when those things were going through, they were talking about people who had to take supplements and things because a lot of times you were not getting enough from our foods. They were concerned back then. But we keep on going back to the same farms a lot.
And also just the uniqueness of a child. How many kids are picky?
Right.
They won't eat anything green, or they won't eat anything smooth, or they won't eat anything crunchy. So they themselves have an issue relative to some aspect of eating. Apparently most children have no issue with fast food.
right.
which is about the most nutrient-depleted substances in the world, but
Nutritionally mugging.
highly loaded with very, very irritating chemicals that affect not only growth and health in general, but neurological function, because
Right.
we're giving them not only poor nutrients, they're not getting the basic nutrients the body was designed to have, but they're giving them all kinds of toxic chemicals.
Yeah, I think another thing to take a look is there's some things going on currently with the Genome Project, and they're feeling that as we get more toxic as a society, some of these mutated chromosomes will actually create problems. They'll
That's
stop
right.
pathways coming along. And ever since the beginning of like antibiotics coming in from World War II, we're seeing more and more problems and more of these cases popping up. Next generation after that. So now we have autism, which is now like epidemic coming up.
Absolutely.
ADHD, these things, fibromyalgia, chronic fatigue syndromes that are coming in. And I think what's happening is we got so much of toxic society, we're actually turning these genes on. We don't know how to turn them off.
We are.
But what's interesting is that with our Ageless Health, we're actually looking at some things like cognitive behavioral therapies and things of that nature that actually can sometimes turn some of those genes off.
Exactly.
Mind over body.
Not only turn off the bad guys, but turn the good ones back
good guys
on again.
You bet.
Food is the original medicine. Our body knows what to do with food.
You are
and
what
if
you
we
eat.
would put real food in, not chemical food, we get a different outcome. And so I want to remind our listeners that Dr. Scott will be doing this presentation this Wednesday evening at 7:30 at our office, Roselle Center for Healing, at 7:30. And we would like for you to give us a call, 703-698-7117, to reserve your place. We have to break again for some more messages, but we'll be back. Hang on.
You've been everywhere, you've done everything, and you still feel like, well, you know. Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Sue Roselle sitting in for Dr. Tom today, and my guest in studio today is Dr. Scott Lamp, your host and presenter this Wednesday evening at Roselle Center in Fairfax for a talk on ADD, ADHD, where you will find out some ways to start working with this particular problem, whether it's your child, your grandchild, or you yourself, without medication, but through natural therapies, nutrition, chiropractic, and how these different modalities can really help with that. Dr. Scott, we were talking a little bit about some of the causes, but tell me how you think this is causing the problems that we're seeing increasing over this period of time.
Well, I think when you go back to the nutrition aspect, the more depleted things are over a period of time, the more you're going to see some of these things. You're seeing that there's more things going in the environment on the nutritional side. We have GMOs now that are constantly they're the constant, not the regular standard vegetable that you used to have.
And we don't know what they're doing to us.
And it's not necessarily GMO, but it's also the insecticides, herbicides, fungicides that are ingrained in those things that cause some of the problems that have a good bacteria. We could probably do a talk almost all on bacteria itself, because the thing is we're lacking that bacteria to some extent. And the thing is, they're starting to find out, we talk about probiotics. There is now a new line of science coming out with pro-viruses, that we're made of a ton of viruses, and we're not doing anything to put those back in. We're still understanding this component. But the more we try to kill these things, we kill them in our bodies, we have some effects. And I think that also has an effect at underlying, like I talked about before about the Genome Project, we're reflecting that maybe in our chromosomes and showing them and having those things show where they wouldn't show before if we were healthy.
Absolutely.
So we have
It's
those.
only been, 30 years that we've really known about the bacterial symbiosis we have in our intestinal tract and the general health of our immune system, and now also how they play a role in our neurological system as well as all the other endocrine balances that go on.
Yeah, and they're genetically they're descriptive to individuals. Your genetic line of bacteria is going to be different than my genetic line of bacteria. So they're getting that specific on some of these things, and it's getting very, very interesting. I'll just on a side note. One of the things is with fecal implants. There's one of the aspects they're talking about now with C. diff in the hospital when things are so sterilized. A lot of people come down with C. diff and MRSA. These are super, super strong bacteria. Superbugs. And what happens is if you take away the generalists, which are your normal bacteria that are around that keep these guys in control, and you wipe them all out, they have all the food supply now.
That's right.
That's their leftover.
So we're really feeding the superbugs. Plus, they no longer have an army to fight against them.
Right.
Because the antibiotics that caused them in the first place killed them off.
Kill them all off. And so what happens is that they're actually putting fecal implants into people and actually seeing some differences in C. diff and in autism and in some of the in what we're talking about, the ADD and ADHDs.
Absolutely.
So there's those aspects. I think we've also got you can talk about vaccines. We're going to talk a little bit more at the talk on that. The vaccines have plenty of issues that are there. The metals, the heavy metals, which associate with that. There's another factor on that.
Right.
I think we're going trends towards more vaccinations.
Well, what is it? 86 vaccines that a child receives from birth to age 5.
Yeah, it's
something ridiculous like that.
It's getting up there, and I think we need to spread out if we're going to do vaccinations. And I just there's a nice website you can go to is the National Vaccine Information Center to find out some of the information on that, and we could probably do another talk on that just by itself.
Yes.
But the thing is that do we need to do these by age of 2? The neurological system is not set up right correctly. There's certain things to look at if you're going to vaccinate. Is the person have a cold or is their immune system compromised? That's not a time to take a shot.
Or do they have an immune system formed yet?
Right.
As in newborns to the age of 12 months.
Exactly.
So
and then also multiple shots at one time. Do you really
right.
want to do that? I mean, it's not necessarily the greatest thing that's there. We got to take a look a little bit on sugar handling too, and how we're feeding our kids, even on the sugar basis.
That's right.
If you don't have any sugar in your system for a period of time, you get foggy thinking, you get fatigued, you're up and down, and that can happen to children just as well. And also if they're not eating the right combinations, everything seems to be card for fast gratification.
I was going to say, but the sugar you're talking about is not from Snickers bars. It's their natural glucose that comes from bodies metabolizing their diet.
Right. And so do we need more proteins and making sure that they have a good mix of foods as they go through? So we got some aspects that are there. Essential fatty acids, environmental allergens, and means, 100,000 now different substances in the air that we're breathing at one particular time.
Exactly.
They're all trace. It's not supposed to be a problem. And then this is a political game, but that adds up.
Plus, you're dealing with a very plastic scenario here.
Yeah.
Children's bodies are rapidly growing, and they're very, very sensitive, by far 100-fold more sensitive than a grown-up. Their brains are developing very rapidly. Their bodies are growing very rapidly. And toxins that grown-ups may be tolerant of or at least able to cope with, children are not. I mean, you can go back years ago when there was that big pesticide scare on apples called Alar. That was shown, it was supposedly approved because it was not going to be too great for causing any kind of neurological problems. Well, that was tested on adults. When they started assessing children who were getting exposed to this, they found that it was extraordinarily toxic to these children. And they apple growers said, well, we can't get rid of it for at least the next 5 years. We have to use up our stock. And people stopped buying apples, and it was amazing. There was no more Alar on the market within about 6 months.
Right. So
because the plasticity of a child growing from infant till 26, okay, it's not infant to 2 or 3. Mm-hmm. Our brains and our bodies are not fully formed till we're somewhere between 25 and 26. These toxins have a much greater impact on the entire system. So we're talking.
You're also talking about, again, the aspects of hormones, and I think one of the things about why do we have kids that are supposed to be, when they first start driving, not to be with multiple people in the car. They can't be listening to music or try to have them so they can focus attention. Their attention is not quite there yet. It has to be mature.
That's right.
One of these things, there's neuroendocrine disruptors, things that plug in that hormones are trying to get into the cell. They can't because of a lot of the herbicides, fungicides, and those are the things there, and we keep on spraying those. And you got the Monsanto's out there and those kind of things. There are a lot of stuff that's being put out that it doesn't seem to affect the human body. That'll be the argument, but also it kills the bacteria in your gut.
That's right.
Which is symbiotic for us to work. And I think we kind of keep on forgetting that we are part of nature. We cannot separate ourselves from it. We're not above there. It's intellect.
That's right. I want to remind our listeners, if you have a question about today's topic, you're welcome to give us a call at 888-630-9625. We're talking to Dr. Scott Lamp in studio today about ADD, ADHD. Dr. Lamp, tell us what's going on as far as situations that we can use. We talk about how can we deal with this without Ritalin. You mentioned that this is not a Ritalin deficiency that we're dealing with here.
Well, I think the first thing is, again, really doing a real good job on, again, if we look at the triangle again and look at the stress aspect, is really looking at the kid as an individual, not as being a part of a population. Mm-hmm. And really, I think we should educate our doctors more in regards to what we're looking for there and how to test that. I think some of the things is also testing coordination. We didn't get into the structural component. It's a huge component here. Cranial aspects, and those the bones are forming. You know, they have that little fontanelle that's on the top part of the head as it's starting to fuse and come together. You know, a child, and maybe even though they're vaginally delivered, they might have a forceps or a suction delivery too. So that can cause a lot of distortions that it cause problems. And you've got right hemisphere of the brain, left hemisphere of the brain, the frontal cortex. You got these things that basically help the body kind of like, interpret the world. If they're distorted, the interpretation is off.
Right.
So your limbic system, your ability to be able to interact and with languages can be affected. The frontal lobe, which has to do with judgment, can now be affected to some extent. Mm-hmm. So if those are out of position, and the thing that they can look at your child is like, oh, my kid, he passed the crawl stage. I never had to do that. He wasn't crawling. He went to walking.
He went straight to walking.
That is a clue. The child should be walking. It develops left and right sidedness.
Yeah,
and so one of the things we look at is go beyond the aspect of saying, okay, he's inattentive. What's his coordination? Is he balanced from side to side?
Right.
Is there visual aspects that are off? Is there audio aspects that are off? Does he react to light in different ways? There's color light therapies that are out there that help with that. Mm-hmm. There's therapies to actually work with coordination. If he's not coordinated and oriented the right way, there's ways to kind of do an exercise with a metronome, for example, and using some clapping aspects to work neurologically to help with that. So there's a lot of things that could be done that we can work on that can make these things work better neurologically. Obviously, with the food aspect, we've just talked about a ton of that. Is the kid balanced? Is he eating at the right times? Is he maybe possibly hypoglycemic? He's missing a meal that all of a sudden he crashes on. Eating the right foods. What are the GMOs doing? What's the vaccinations doing? And really getting to know your kid and understanding and asking the questions of our doctors.
And then, of course, the obvious is, did the kid hit his head hard?
Right, yeah.
Okay? I mean, walking is one of the most dangerous activities a baby goes through. And they're always cracking their heads against things.
And how was mom's pregnancy?
That's right.
I mean, mom's pregnancy of something of that nature. Was she diabetic? Did she have gestational diabetes? Did she have problems with that? Did she have eclampsia and things of that nature? So there's those type of things that are having problems. So that's one of the things we're working on. Yeah.
Looks like we have a caller. Hello.
Yes, I'm here.
Is it Raja?
Yes, madam.
From Leesburg. Tell me about your situation.
Yeah, we got a 14 years old, and he was diagnosed a few years back, ADHD, was 5th and 6th grade. And we did use for about 8 months Ritalin. Then we took him off because I don't see any effect on the medication. And since that, he went to therapy and some counseling. But now he's 14 years old, and he's not socialing. He's okay with the friends, but education, he's A and B's, not too much complaint from the school. But he has a very serious problem with the anger, and he cannot control himself, and we do not want to use medication again.
Mm-hmm.
So I have an appointment with the doctor to have him tested done next week.
Okay.
What else we can do to help our son?
What kind of appetite does he have? Hello? Still there? Did we lose him?
I think we lost him. One of the things that we might want to look at in your situation, if you're still able to hear us, would be to take a look at what his appetite is like, what his diet is like. That's always a good first line of start. Does he eat a lot of the same foods? Is he tending to want to eat a lot of dairy products or eat a lot of bread products? And
what's his
that
cravings?
Sort of thing?
Yeah,
what does he crave? That's often an indicator.
Is it a gluten problem that's associated with this?
It could often be an allergy thing,
Yeah.
which will jangle up the brain's function.
You can get addicted to, let's say, for example, if it's a milk type thing that basically the body's not digesting it, but that almost creates like an addiction to it. So it's like every time you eat it, it creates a problem.
It does.
And basically has an effect on inflammation to some extent to the brain. There's a brain-body
Absolutely.
combination that's there. Again, also got to take a look at what is his strengths and what is his weaknesses. Is he audio vision? Is he kinesthetic?
Right.
Is he those kind of things? Kind of find out what those are. Now you at the awkward age of 13 and 14, you've got the peer situation that's going on, peer group situation that's going into schools.
And the adolescent hormonal shifting.
And hormonal shifting. So you got to make sure that the nutrition is important to put in that place. Again, if the person, there's some clues. If he doesn't memorize dreams, there's some things associated with memory that could play a part with that, or some nutritional aspects that can play a part with that. You've got things like also, does he have breakouts and skins and rashes? Does he have a yeast problem? Does he have things in regards to maybe the possibility of not having enough essential fatty acids, for example?
Right. Does he have allergies to the environment?
To the environment. So, and then neurologically, you really take a look at that. Like, how was the birthing process? How was mom's health as he went through? Has he hit in his head? Is he balanced? Is he uncoordinated? He's not getting the right processing information from left to right side. You can have a fallen arch in your foot. Your foot drops down. I've seen people with a fallen arch and have a headache. I'm like, what the heck is that? Well, that's actually affecting the cranial vaults. It's actually pulling on the meninges and meningeal torque over a period of time. My foot drops down. My back adjusts to that. My head adjusts to that, and I'm torquing my head. And the body needs a balance. You can't be working on one side and not on the other side of the body. So you got to actually get them working better.
If you have a question, Raja, and would like to call us at the office, it's 703-698-7117, or talk to Dr. Roselle or any of our docs, Dr. Lamp, get in touch with us through rosellcare.com. We have another call on the line. David?
Good morning.
Good
Hey,
morning.
David.
Well, actually, it's afternoon.
Actually, it is afternoon now that you mention it.
And you have a question about ADD and autistic diagnoses.
Well, actually, I wanted to comment on the increase in diagnoses.
Okay.
And it's something that most people aren't aware of unless they have a child that has been diagnosed. The first thing that happens when your child is in the school system and they diagnose them with either one of those two conditions is the school gets more money.
Yes.
Yeah.
Yeah. There's a funding aspect.
The teachers then are no longer responsible for educating the children.
And there's incentives for that.
Right. So what I'm saying is there's nothing but incentive to have more and more diagnoses.
That's why they wanted to screen out everybody that starts kindergarten.
And that's one of the problems, too, is when you're trying to get good information out there, there's a lot of money towards this whole situation. So,
further than that, they don't distinguish between such things as the Einstein syndrome, which are late talkers that are very intelligent.
Right. David, I'm interested in hearing what you have to say, but we're going to have to stop for a moment for a break. Would you please stay on the line, and we'll get back to you when we come back? Thank you.
Are you dentalphobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
105.9 FM and AM 630 WMAL.
Welcome back to Dr. Tom Roselle Live. This is Sue Roselle sitting in for Dr. Tom this week, and in studio my guest is Dr. Scott Lamp. And we're here every Sunday, the same time and place on your dial, bringing you the most interesting and up-to-date information on natural therapies without drugs or surgery. This is a place to get some questions answered. When we left for break, we had a gentleman on hold. David, are you still there?
I'm still here.
Okay. We've got about 1 minute. Can you give us some information beyond what you had already given us about the funding being an appropriate way for people to want to encourage labeling?
Things to investigate would be, and you can. There's a book called the Einstein syndrome that covers a lot of the gifted children who are diagnosed ADD incorrectly. There's also another resource called the Option Institute. It's up in Massachusetts, and there's a tremendous amount of information they have available on dealing with autistic children, and their success rate is extremely high. The founders had a severely autistic child, and the school system had given up on him, and they worked with him extensively. The young man recently graduated with his master's degree, and he now is one of the directors of the Option Institute.
Fantastic.
Well, one of the things, David, is also, too, is like Edison and Sir Winston Churchill also had similar type situations where, I mean, you got some amazing individuals that came from places where they're having some problems in schools.
Well, exactly. Another one is Einstein. He didn't talk until he was 4.
Yeah,
and he couldn't balance a checkbook, but he had a...
Yeah, and the last thing I'll say to this, I think one of the problems is also, like, even some of the programs that come into school, or some of these are backed by the pharmaceutical companies that are actually pushing the medication.
That's right.
So some of the ADD and ADHD programs have like, oh, well, we're pushing and they're actually backed by, over like $1 million sometimes putting into these programs to go into the schools.
Thank you for your call, David. We appreciate your input, and that information for those people that might be interested is the Option Institute for Autistic Children and the Einstein Syndrome. Good references. Thank you. Dr. Scott.
Yeah.
Give us an idea of who would be the best candidates to come for your lecture this Wednesday evening.
Well, anybody that's suffering with the ADD, ADHD diagnostic aspects that they already seem to have that. It could be also, obviously, children, parents of children. Adults also would be the other aspect to take a look at it, because what they find with Ritalin, after you've taken it off and, you go back into 70% of the population that were on Ritalin before still have the same symptoms as they go into adulthood.
That's right.
So that would be good. I think mothers, or expecting mothers, would be a good population to come into, because if you've had some problems with, for your nutrition, you've had some problems with, again, with diabetes and stuff of that nature, or a history of problems of hard births and stuff of that nature, have some C-sections, or expecting those, some things to look for, and we'll talk about some of those elements. So
you're basically going to cover this aspect from our triad of health, chemical, physical, and emotional,
right,
because that is what ADD, ADHD is all about, along with all the other learning syndromes that we have out there.
Exactly.
Again, reminder, that's this Wednesday night, 7:30 at Roselle Center for Healing, September the 16th. And also reminder of Ageless Health coming up October 17th. Full day worth of amazing information on your mind and body health, ways to keep you strong and healthy and focused and functioning and excelling in your life without drugs, surgery, and needless medication interventions. So we hope that you'll give us a call. Our seating is filling up rather rapidly, so it's 703-698-7117, and we look forward to seeing you both this Wednesday evening and hopefully October the 17th at the Fairview Marriott. Dr. Scott, any closing comment?
At the event, we're going to have some things that you can take home with you. There's a couple of questionnaires that work well on nutritional aspects, work on different aspects on sugar handling. Things are looking at neurotransmitters, like we mentioned before, so there'll be good things to have to work with your children and at least walk away with some information that's going to really help you out.
Tools to use.
You bet.
Okay. Thanks for being with me today.
Likewise.
Dr. Tom will be back in the studio next week. And until that period of time, have a great week. Study hard, kids.
There you go. That means my kids, too.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.